Today we are going to discuss about transient ischemic attack. These are focal ischemic cerebral neurological deficits that last for less than 24 hours, and most often we can say they last for less than 1 to 2 hours. Many patients with TIA, they are at great risk of developing major stroke within first 48 hours. So prompt and proper treatment is very important to avoid major stroke. Now coming to etiology, there are many causes. One of the most important causes is embolization. So the emboli, they may either develop and come from atrial chamber due to atrial fibrillation, or they may come from atherosclerotic plaque from common carotid artery. And sometimes the atrial septal defects and patent foramen ovale, they may permit emboli from the veins. These are known as paradoxical emboli. Then TIA may also sometimes caused by thrombosis directly in the cerebral vasculature. Then carotid stenosis is another possible cause. Another cause is subclavian steal syndrome. So the subclavian steal syndrome usually occurs if there is stenosis of proximal left or right subclavian artery, which may result in retrograde flow down the vertebral artery on exercising the arm, and thus the blood is stolen from this artery. So that's the reason why we call it subclavian steal syndrome. Then TIA may be due to hematological causes like sickle cell disease, polycythemia, or hyperviscosity syndromes. Now coming to risk factors, they may be non-modifiable risk factors, like example age more than 55 years, or they may be modifiable like smoking, hypertension, diabetes mellitus, etc. Now let's discuss about signs and symptoms. So they basically depends on arterial distribution which is affected. In 90% cases, the anterior territory is affected, which is supplied by carotid arteries, and in 7% cases, posterior territory is involved, which is supplied by vertebrobasilar arteries. In case if anterior territory is involved, the person may develop hemiparesis, hemisensory disturbance, dysphagia, or monocular blindness. We may also call it amaurosis fugax. In case of posterior territory involvement, there may be loss of consciousness, bilateral motor or sensory disturbance, binocular blindness, or there may be a combination of vertigo, tinnitus, diplopia, and dysarthria. In a small number of cases, the features don't fit in either category, like for example, dysarthria occurring together with hemiparesis. Now let's come to diagnosis. So we can say it can be diagnosed based on clinical examination, imaging, cardiac rhythm monitoring, and laboratory workup. So the clinical features we already discussed. Now coming to imaging, ideally CT, MRI should be done within first 24 hours. In case if significant stenosis of internal carotid artery is suspected, then carotid duplex ultrasonography can be done. Then MR-CT angiography can be done for broader visualization of cervical and intracranial vasculature. And finally, cerebral arteriography can be done. This is considered a gold standard for investigating the integrity of cervical and cerebral vasculature. Then for monitoring the cardiac rhythm, ECG and Holter monitoring, they should be done. Then coming to laboratory workup, tests like CBC, complete blood count, FBG, fasting blood glucose, lipid profile, prothrombin time, and partial thromboplastin time must be performed as soon as possible. Now let's come to management. So early hospitalization should be done for patients reporting within first 72 hours and having ABCD score of 3 or more. Then efforts should be made to control or eliminate modifiable risk factors like hypertension. We can control it with antihypertensives. Then control cholesterol with statin therapy, and control diabetes by using insulin or anti-diabetic medications. It is also important to counsel the patient to avoid smoking and alcohol use. Then next important thing is to eliminate the underlying cause. Like if there are emboli from the heart, start anticoagulant therapy like warfarin or apixaban. In case of non-cardioembolic attacks, antiplatelet therapy like aspirin, dipyridamole or clopidogrel can be used. And in cases where arteriography reveals a surgically accessible high-grade stenosis like 70 to 99% in luminal diameter, then carotid endarterectomy should be considered. So that's all for today. Thank you. Have a nice day.